Hey guys, so today we're going to talk about obesity and atherosclerosis. Obesity is defined as a patient who is grossly overweight, while atherosclerosis is a plaque buildup in the tunica media of your vessel wall. We're going to talk about the different things that adipose tissue release into the body and how it affects the body's ability to compensate in different ways. Adipose tissue generally builds up in the body when we have a poor diet or lack of exercise. It can also occur genetically, or when we have an increased amount of leptin in our bodies due to the excess adipose tissue. When adipose tissue builds up, it releases different types of molecules that have multiple effects on the body systemically. When adipose tissue builds up, it stimulates the renal cortex to produce more angiotensin. Now, angiotensin, which will be the green blocks, is used by the ROS system in the kidneys to regulate blood pressure in two different ways. Primarily, it triggers vasoconstriction. Secondarily, it opens up sodium pumps to allow for water retention. Water will be the blue box. Adipose tissue also affects blood pressure by stimulating the hypothalamus to produce more vasopressin and also stimulates the pituitary gland to release more vasopressin. For this demonstration, I'm using a bionicle skull to represent the brain. This release of vasopressin also binds to the blood vessels, making them constrict to increase blood pressure. When adipose tissue builds up, it starts to release cholesterol, represented by the small yellow blocks. When cholesterol is released, it enters the bloodstream and increases the risk of atherosclerosis, which we will talk about soon. Adipose tissue also releases its own form of inflammatory mediator called adipokines, which are represented by the blue blocks. This increase of adipokines increases the clotting factor and blood vessel repair in the obese patient. This increases the obese patient's risk of a heart attack. So now we're going to talk about atherosclerosis. In our blood vessels, we have three different layers. We have our tunica externa, tunica media, and the tunica intima. The tunica intima would be the innermost red blocks. The tunica media is the middle row, and the tunica externa is the outermost red blocks. If an obese patient smokes, it increases the risk of developing atherosclerosis as it increases their cholesterol levels, and the nicotine can damage blood vessels. Cholesterol will be represented in yellow, and the nicotine will be the orange blocks. We also have to remember that because this person is obese, they will have an increased blood pressure as opposed to the normal person. As the pressure and cholesterol build up in the blood vessels, it starts to damage the epithelial walls. As the walls are damaged, cholesterol begins to stick into the tunica media and build up. This epithelial damage and buildup of cholesterol triggers an immune response, and monocytes are sent to the site. The monocytes are represented by the white characters. When the monocytes reach the damaged epithelial cells, they differentiate into macrophages and begin to consume the cholesterol. As the macrophage engulfs the cholesterol, it becomes a fat-laden foam cell, represented by the yellow bricks bordered by the white bricks. The fat-laden foam cells become stuck in the tunica media, along with more cholesterol. The tunica intima then begins to repair itself, while the fat-laden foam cells recruit smooth muscle cells. Now, there are blood vessels that supply the vessels themselves. However, due to the buildup of foam cells, smooth muscle cells, and cholesterol, the vessel cannot supply the tunica intima underneath the plaque. This causes the tunica intima to become fibrous and easy to rupture. Once the plaque is formed, it would also begin to encroach on the vessel, making it more difficult for blood to travel through the vessel. A vessel blockage can occur by two methods. The first method is when the plaque encroaches the vessel so much that it promotes blood stagnation and it clots on its own. The second method is if the plaque ruptures, leaking its contents, promoting inflammatory mediators to clot within the vessel, therefore obstructing the blood flow. In a heart attack or myocardial infarction, this blockage of the vessel is occurring in a coronary artery. When the vessel is blocked, it prevents oxygenation to the heart muscle itself, and it becomes ischemic and then necrotic, leading to heart failure and then death. Signs and symptoms of a heart attack are generally well known. Chest pain is the number one symptom, generally described as a heavy, squeezing pain that radiates to the shoulder or jaw. It sometimes relates to feeling like an elephant is sitting on your chest. Nausea and vomiting are also extremely common in a heart attack or myocardial infarction. Shortness of breath is also a common side of heart attacks due to the lack of oxygen going to your heart because of your blockage, so your body attempts to compensate by making you breathe harder. Patients can also often present signs of diaphoresis or intense sweating. They can also present with intense headaches and can feel lightheaded. So, obesity has been an issue for years and is only getting progressively worse. It is a condition that continuously affects people's lives and is generally caused by poor lifestyle choices. It can be compared to addiction and drug use, as there are genetic factors. However, it is primarily an issue due to lifestyle choices. Do you think we have a worse stigma against obesity or addiction as paramedics? Why do you think that? And what are the implications of this for paramedics? It's important to understand that obesity is a pandemic and can affect anyone at any age, so younger people are at a higher risk for heart attacks and strokes. Paramedics will also face the challenges of extrication, transport, and stigma when attending calls with a bariatric patient. It is important to understand these challenges, especially when the patient is in an acute condition.